Hi, my name is Greta Leoncio, and I am here to talk about the benefits of breast care nurse certification. Breast care nurse certification is the only national accredited breast care nursing certification that is available exclusively to registered nurses and that covers the entire spectrum of breast care nursing practice. The process to obtain clinical certification: if you are eligible to test, you'll receive an authorization to test within 2 weeks of applying. This ATT will open an almost immediate 90-day testing window. You must take the test within the 90-day window. If you are a member of the Oncology Nursing Society or Association of Pediatric Hematology Oncology Nurses, the cost is $296, and for non-members is $416. Requirements prior to certification: you must have a current active license as an RN in the United States and its territories or Canada at the time of application. A minimum of 2 years experience as an RN within 4 years prior to application. A minimum of 2,000 hours of breast care nursing practice within 4 years prior to application. Completed a minimum of 10 contact hours of nursing CEUs in breast care nursing or an academic elective in breast care nursing within 3 years prior to application. The nursing practice may be in clinical practice, nursing administration, education, research, or consultation. And your contact hours must have been provided or formally approved by an acceptable accredited provider or approver for continuing nursing education or nursing continuing professional development. Okay, the certification test is a 3-hour 165 multiple choice test based on certification breast care nurse test content outline. The test content outline is based on the results of a role delineation study of basic breast care nursing practice that was conducted in 2016. And your renewal time and process, according to the Oncology Nursing Certification Corporations, once you pass the exam, your certification is valid for 4 years. And requirements for renewal: you have to have a current certification breast care nurse, uh, current active license as a registered nurse in the United States, its territories, or Canada at the time of application or examination. A minimum of 1 year of experience as an RN within 3 years prior to application, and a minimum of 1,000 hours of breast care nursing practice within the 2.5 years prior to application. So, our problem statement is a knowledge deficit related to breast care nurse certification among plastic surgery nurses in the plastic surgery department, as manifested by increase in infection complications secondary to non-compliance of patient postoperatively. Breast care nurse certification is mainly seen in oncology nursing. However, breast cancer patients' treatment does not end with radiology or chemotherapy. After that process is done, patients also seek reconstruction treatment. This is where plastic surgery nurses come into play. Having this certification could be beneficial to these nurses as well. Why are nurses not knowledgeable about the certification? It could be that nurses are not aware of such certification, lack of reward for attaining the certification, not encouraged by department leaders, and it could be costly. The article, during this research, I came across with this article in the role of breast care nurses in patient and family care. The article talks about a survey that deals with the significant role of a breast care nurse play in patients and their families who are going through breast cancer. Breast care nurse is shown as patient advocates, educators, coordinators, and clinical experts. They not only make an impact on a clinical setting but in the community as well. According to the article, certification breast care nurse is also involved providing patient centered care, such as advice, psychosocial support, counseling, and support to women at all phases of the woman's breast cancer journey. Certified breast care nurse has specialized training and in-depth knowledge regarding breast health, treatment process, and aftercare management. In plastic surgery, breast care nurse is involved in the treatment of breast cancer patients through its various stages of their breast reconstruction. Patients are seen multiple times by their surgeon for breast care post-op and follow-ups. A certified breast care nurse will have a specialized training to educate patients with their aftercare expectations, incision care, pain management, drain care, seroma management, and the importance of compliance to avoid complications, infections, and longer healing time. Also, it helps patients' psychological well being by giving them emotional support. Breast care nurse has specialized training and depth knowledge about breast health, treatment process, and aftercare management. Breast care nurse has specialized training to extensively educate patients with their aftercare expectations, incision care, pain management, drain care, and importantly, compliance to teachings to avoid infections, complications, especially during the first few weeks of post op. This translates to a higher quality of care for patients and a more qualified nursing staff to ensure consistent patient safety and satisfaction. So now that you have learned about breast care nurse certification, would you be interested in attaining this certification? What do you think are the advantages of having a breast care nurse certification in your clinic? Do you think there is a difference whether you are a certified breast care nurse or not? Thank you for your time, and please don't forget to fill out the post survey.